We're back on. It's Dr. Gary Schliffer here with the Coach app. We're going to have Dr. Joshua Rowland on in just a few minutes. We're going to talk about sleep. It's one of the most important things I can emphasize to all of you listening. Focus on your sleep, and I really want to get into it. I've got a lot of questions for Josh.
Yeah, excited to be here. So thanks for having me.
Oh man, I'm excited to talk to you. Tell everyone about yourself. I kind of introduced you as a sleep specialist, but tell everyone what brings you here.
Yeah, so I'm a board certified sleep medicine physician. Work clinically treating sleep disorders, helping with general sleep conditions. Currently work for UCLA. Also boarded in family medicine as well. Serve on the California Sleep Society Board of Directors, work for the American Academy of Sleep Medicine doing research, and lucky to serve as well to the sleep advisor to the coach. So hopefully can help you out, everyone out there either struggling with sleep issues or is interested in learning more about sleep and how it pertains to their other goals. So happy to be here.
I love it. So look, I mean, I think it's to me, it's really obvious in my practice. Sleep is totally neglected. We grew up hearing, sleep when you're dead. It's a waste of time. I got to be productive. Through I don't know about your experience, but through my residency, sleep was, if you were tired and you had to sleep, it was almost looked frowned upon, and these are physicians training, people's lives in their hands. I never liked that. And I know that they're working to fix that. But how did we get here? Why do you think sleep is so neglected? Like, what's going on?
Yeah, so it's a great point that you make. Want to completely support what your statements there. Sleep really is such a pillar of health and such a pillar of wellness. Really, is such a basic underlying biological process that we need, just like we need to breathe, we need to eat. So it's kind of amazing that sometimes that it's neglected, and not only neglected, as you mentioned, it's sometimes almost worn as a badge of honor between, maybe guys a little bit more, but certainly in medicine we experience it as well, where it almost looks like you're working harder, you're trying to crush it more if you're not sleeping and you're really pulling late nights doing studying or working. But really it's so far from the truth, where we know you need sleep to be efficient at these the tasks we're doing, to be healthy, to be physically, mentally sharp. Major problem in medicine is, you're well aware, where, so much training and even practicing right now is done under poor sleep conditions. We know that's really unsafe. So I know many of the medical bodies are working to fix this a little bit, but it's still a major issue. Just issues with focus, cognitive processing, it's all really impacted when we're not getting enough sleep. And there was a study that came out a while ago, but it kind of corresponded alcohol intake or alcohol function with cognitive function and sleep deprivation. And it showed that actually not getting a night of sleep is equal to having a couple drinks, which will arrest people if they drive drunk, but not necessarily if they're sleep deprived. We'll let doctors work in the OR, sleep deprived. You really want your doctor performing surgery under the influence of alcohol. So it's kind of amazing that this is still so prevalent in our culture, and hopefully something we can continue to work on at, kind of correcting the attitude about sleep.
That's my goal. I want people to understand, if you're going to train hard, right? If you're going to go to the gym, you're going to try to put on muscles. If you want to perform sexually, there's so many parts of your life that are affected by sleep. So what happens? Like, I guess a fun way to think about it is, when you're not sleeping well, like what starts happening? Hormones. It's a big question, but I kind of want to see like where your head is at.
So you hit on a lot of great points there, and I think, the question is, particularly with men's health, is, in men's lifestyle, it often is one of the neglected pillars of health. But really, to succeed in any of the other pillars of health, you really need sleep kind of going along with it. So whether it's, as you mentioned, whether it's working out, getting in shape, crushing it at work kind of cognitively, or, your social life, your love life, sleep's really required for any of those things, in addition to your overall health there. So, there's tons of studies out there looking at different aspects of cognitive function and health under sleep deprivation. So kind of one of the first things that happens that, as mentioned, we need sleep really just like we need to breathe, just like we need to eat. Can really only last about, 2 days before you start to hallucinate. By a couple days in, your body shuts down and your body drives itself to get sleep. And you can actually, if you're not getting enough sleep, there's this disorder you might have heard of, familial fatal insomnia syndrome, where people just have this prion, or kind of this protein disease in the brain, that actually don't sleep, and they die from lack of sleep. And it's actually kind of a pretty horrible death. So kind of initially when you're not sleeping, what happens is a lot of processes in the body are very biologically regulated, and we look at them in two ways: either circadian regulated in terms of, working on a 24-hour cycle, roughly, or sleep regulated, where sleep is needed to regulate those hormones directly. So you mentioned working out. Testosterone and actually growth hormone are two hormones that we know are sleep related, where we really will not get those hormones unless we're getting sleep. So, if you have a workout routine that you're trying to, really work towards, and, you have social life and work obligations, and you're neglecting sleep, you're not going to get the efficiency out of your workout. You're not going to build muscle. And a lot of it's due to not releasing the testosterone, or even creating the testosterone that you need, or growth hormone, or a couple of these hormones that are really sleep regulated. So sleep's just so important, such a function of our biology, that when we're not getting it, everything gets thrown off. Cognitive function, we know rapid eye movement sleep, or REM sleep, is really needed to obtain good focus, good memory. We're actually realizing more and more that many people with ADHD actually have undiagnosed sleep apnea, which really limits REM sleep in particular. Pediatric patients, many times with sleep apnea, have symptoms of ADHD, really kind of highlighting just the need for sleep in terms of cognitive performance. And you can go pretty much break down any organ system, and there's studies out there that show that sleep deprivation starts to affect it. Cardiovascular disease is a major issue, as I'm sure you're aware of there, where if we're not getting enough sleep, or have sleep disorders, sleep apnea, one of the first things that happens is that the body releases a lot of stress hormones, so catecholamines, adrenal function hormones, cortisol, exactly. And these cause a lot of strain on the cardiovascular system. The heart has to work harder, really puts our bodies into fight or flight mode, which serves a purpose evolutionarily, but, flight or flight mode is meant to suck in anything you need for quick action, for survival, for quick decision making, but it's not sustainable. All that really takes toll on the overall organism kind of long term. So it's not a state that we're supposed to live in for that long. Cortisol impacts, again, the cardiovascular function, also impacts insulin. So insulin is you get kind of insulin resistance and diabetes almost from cortisol. So major impact on multiple systems in the body there.
Man, you touched on so much of it, and just a fun way to wrap it together is it really just manipulates your hormones in an abnormal way, and then it has these downstream effects of, decreasing function cognitively, physically. You lose the ability to run a healthy metabolism, so you're going to gain weight. You're not going to manage your calories efficiently. You're going to store more fat. And I don't know if we mentioned it, but I think especially for a men's health talk, it certainly affects your libido. And I think a lot of that has to do with the low testosterone that you're going to get from chronically being sleep deprived.
Absolutely. Testosterone, also luteinizing hormone, follicle stimulating hormone, LH, FSH. These are all really driven by sleep processes. We need sleep to really rest and form these molecules. So for libido, if testosterone is not present, not only does it affect muscle, but as mentioned, affects kind of sex drive. We also know that even things such as the amount of semen produced, testicle size, these are all actually decreased if there's sleep deprivation. Studies have actually shown. So it's very interesting that how physically sleep deprivation can really impact all these hormones that we need for functioning.
It's so interesting because, people come to me having issues with their libido all the time. Obviously, you see that all the time. People I'm an internist. I see diabetes. I see, doc, I can't get rid of this extra belly fat. someone's really working hard on a great nutrition program and still their fasting insulin, which is something I look at all the time, morning fasting insulin, is still elevated. And, then I start asking them about their sleep and they're confused and, they want to talk to me about hormone replacement. And I'm like, no, this is lifestyle medicine. We're going to talk about a lot of strategies we can use to optimize our sleep. But, I don't think it's even on people's radar when they're having these different issues. They're like, hey, I can't keep muscle on. I'm training super hard. You're also sleeping 4 hours a night because you're working too much and you can't have any work-life balance. So, God, it's so interesting to see what we've learned about sleep. You mentioned heart disease. Something that's really interested me is brain disease. We have, I do a lot of geriatrics medicine. I kind of on both sides. Preventative care and then geriatrics medicine is kind of how I found my niche. But with the older population, you just see crazy high rates of Alzheimer's disease, various kinds of dementia, Lewy body dementia. It's a lot of cognitive diseases that are going up. And a lot of new research I know is being done looking at how sleep relates to this. What do you think about that? I honestly think that Alzheimer's disease, the huge growth in it is a combination of hyperglycemia in the brain, like a basic metabolic disorder in the brain, paired with not enough sleep, not enough focus on relaxation. And especially, I think it's going to get worse as everyone's sitting there staring at their phone all night. You know what I mean? So I'm sure that's something you're thinking about and you're seeing in your sleep clinics, huh?
100%. I think that's a great topic, great point. I actually just published a paper on Alzheimer's disease and sleep and kind of insomnia in particular, sleep disturbance. So yeah, you touched on some of the factors there, glucose regulation, hormonal regulation. What we think too is that sleep is important to kind of cleanse some of the CSF or the cerebral spinal fluid that surrounds the brain and the spinal cord. And if that's not happening, if you're not getting enough sleep or good quality sleep, what can happen is there can kind of be waste products that get stuck there, we think. So proteins that get left behind. And over time, kind of the theory and some of the data suggesting that these proteins can kind of group up and form tangles and kind of clusters. And that is what actually we think leads to Alzheimer's disease, where then these get clogged up in the neuronal pathways of the brain, really limit the functioning of the brain. And we think sleep actually plays a major role in things like Alzheimer's disease and other dementia there. So, it's something that, unfortunately for many of the patients, it's sometimes the damage is done, but, if anyone, kind of preventing these things are at risk, it's important to get your sleep to really kind of help reduce your risk of Alzheimer's disease and other form of dementia.
Yeah, you're referring to so when I was in medical school, Alzheimer's disease was correlated with these amyloid plaques. They would look at the brains after a patient passed, and they would see these plaques forming on the brain, and they would say, oh, these are causing the dementia. And now the theory is that actually during sleep, you're clearing these plaques. You're cleansing your brain. Your brain is having time to rest. And is that still the kind of work in theory? Because I think that's fascinating and makes so much sense.
Yeah, 100%. It kind of goes back to the basic function of sleep in general. Why do we sleep? Why do we have this huge period of our day where we're inactive? And a lot of it is our bodies need it. We need it to recharge, to grow, just to kind of sustain kind of this cycle, the biological cycles that are built into us. And humans aren't alone. Pretty much every species of vertebrate has some form of sleep. So it's something that's really needed in terms of processing. And that's kind of how things are built, with these proteins and stuff. Is sleep is needed to really clear them out. And, you highlighted the phones there. It's kind of a newer issue where, I'm sure people had sleep problems all throughout history, but we're in such a unique period right now where most of the time it got dark through most of human history. Right now it's dark super early, right? And there wasn't much to do. Maybe we sat around a campfire, talked with friends, family, ate a little bit, and, we went to sleep pretty regularly at the same time every day. We didn't have all these stimulating blue light devices and which can wake the mind up and kind of limit your own melatonin secretion, disrupt your own circadian rhythm, but also provide a lot of stimulating content. We're really what was kind of meant to happen is we're supposed to get almost bored leading up to bedtime and help us get to sleep and have these long, periods of inactivity to let all these biological processes kind of occur that so many times now, due to work schedule, social life, Netflix, Instagram, these things are now thrown off, and we're actually really limiting our sleep time, and it's having, really resultant health and cognitive consequences.
So we need to sleep to restore our brain. It's true for the body too, right? So when I was weightlifting and really into exercise, I still love it. But, when I was younger and I was really, really into it, one of the key things I learned was if you're going to train really hard, you've got to let your body rest. And it's during that rest that your body's actually going to build muscle. So I actually don't know any of the mechanisms behind that. Maybe you do, but I think that's so fascinating that it's not just the brain that's clearing out, it's actually your body building and growing. Even like kiddos, right? They're growing during their sleep, right? That's where, at least I'm again, not a pediatrician, but that's conceptually what I understand. Can you talk about the body?
No, 100%. And, kids get a lot more sleep and need a lot more sleep than adults. And a good part of that reason is, they're growing so much, and you can't really grow when you're active and moving around and using energy. You really need to divert that energy into growth mechanisms. And some of it, it's pretty complex, but some of it is just the release of growth hormone, release of some of the other processes that go on to kind of, in terms of muscle, build muscle. When you're lifting, you're breaking down that muscle, causing damage to the muscle in a sense. And for that to heal up and grow, sleep is very much needed to accomplish that. So any kind of workout routine, you really need at least 7 hours of sleep built in there to really optimize it, or, that routine's really not sustainable. You might get some short-term gains and have a couple of good workouts, but over time, you're not going to have the, kind of the time allowed to build and just the regulation of your biological processes to build that muscle and have kind of the long-term sustained gains you want in terms of working out. And then the other factor is energy. If you're not getting enough sleep, it's hard to have the energy to, to crush a workout. If you're tired, it's really just kind of goes against what you're trying. People power through with caffeine a little bit. That can worsen their sleep, and then it becomes this kind of vicious cycle that is, catches up to you eventually in terms of either health or, you cut your outcomes there in terms of, exercise and strengthening programs and things like that.
I love it. And you said so many things, but I think it goes to the main question. So how much sleep do we need?
Yeah, so the data pretty much suggests that most people need at least 7 hours. They've shown that all-cause mortality goes up if it's less than, meaning all passing away for any reason goes up if it's less than 7 hours of sleep. And also, though, actually interesting, it shows it goes up if it's over 9 hours of sleep. Now, some of these are associative studies, meaning that just because they're linked together, but doesn't necessarily mean they're caused by it. But generally, the consensus is you need at least 7 or 8 hours of sleep. There's individual variation as well. There are probably some people who can get away with, 6.5, something like that. Some people really need 8.5. Some it's going to vary on what you're doing too. If you really are working out hard and expending a lot of energy, you'll need a little bit more sleep to rebuild and kind of regroup there. So, generally what I tell patients is try to get at least 7-8 hours. It's probably what most people need, at least on a chronic level.
And we had an awesome question. I have the same question. Rest versus sleep. Does resting count if you just lay down on the couch and chill out for 20 minutes? How's that? Even not a nap. Because I think I understand, like, a nap is good for you. It's still effective in restoring your mind. But maybe you can clarify that, like rest versus nap versus sleep.
Yeah, so sleep versus nap, we'll kind of start there. We go into sleep, there's kind of these cycles that happen. We go from kind of non-REM sleep 1 to 2, non-REM sleep 2 to non-REM sleep 3, which is deeper sleep, and then to REM sleep. And then the cycle kind of repeats, usually about every 90 minutes to 2 hours, gets a little bit more condensed in the early morning. When we nap, we really shouldn't be getting all those cycles. So it's not quite doing the same thing in terms of function. And actually, if you take too long a nap and you start to go into REM sleep or slow wave sleep, then it throws off your whole internal clock, your whole circadian rhythm, It can make it harder to go to sleep at night. So if you are taking naps, we usually recommend taking a power nap. 20 minutes is usually pretty good, where you're getting a little bit of that restoration, but not really going to these deep cycles of sleep that throw off your whole clock. In terms of the rest versus sleep, they're definitely different, but I think there is still value of getting the rest. We can look at brain waves in the sleep lab. We look at brain waves through EEG, and we can monitor what's going on in different stages of sleep and different stages of rest. And you can actually watch a patient who's awake as they start to get more sleepy. You can see slowing of the brain waves. So, there is some process going on that's potentially helpful, potentially a little restful. If anyone does mindfulness or meditation, which I highly recommend for kind of relaxation and getting into the, kind of de-escalating from the day to get into sleep, these things have shown to kind of have that similar pattern on EEG, where there is some rest going on, is some, restoration. So it's not going to make up for, a whole night of sleep, obviously, or even a nap. But, if you have some moments and you're tired, just kind of closing the eyes and resting a little bit. Or, some patients ask that, at night, if they, they're not sleeping right away, are they still getting some value out of it? And, if you're laying there, eyes closed, and you're not in a deep sleep, you're kind of a light stage, you probably are still resting a little bit. Now, you don't want to do that too long where you get frustrated and start to kind of worsen your sleep hygiene, spending a lot of time in bed, not awake. But I absolutely, do think there's value in getting a little bit of rest, even outside of naps and sleep.
Yeah, absolutely. During my training, when I wasn't sleeping much and doing my 30+ hour calls, a 20-minute, even if I didn't sleep, just shutting my brain down for 20 minutes was a game changer for my performance. So I totally agree with you. I want to get into what causes us to sleep bad. I think the question of what causes us to sleep badly or interferes with our sleep is the same as the tools for how you can sleep better, because for each reason why we're not sleeping is a reason, is something we can do for it. Does that make sense? So like for every problem we're going to identify, we're going to give you guys a solution, an option, or a way to tackle it. Before we go there, I think a fun question is about sleep monitoring. So you mentioned the different sleep cycles. You mentioned that, some sleep is restorative and some is perhaps not as effective at healing, for lack of a better word. What is there a way that you guys as professionals monitor that or can measure that? And what role do some of these sleep monitors play? Like the Oura Ring is a really popular one. Even our iPhones can monitor some component of our sleep. Honestly, I don't know what they're monitoring. I don't know how the iPhone can tell me how well I slept. I can't figure out really what the Oura Ring is doing. So can you talk a little bit about like what you guys do on the professional level and the tools we have, in the field?
Yeah, it's a great question. So, really the way we diagnose and look at sleep and analyze sleep in clinical setting and also research setting is in a sleep study, which involves several things. So one of the main things is the EEG. So kind of sticky tabs on the head, which look at brain waves that can tell what stage of sleep people are in. We also measure for REM sleep in particular is a very unique stage of sleep where the muscles are actually atonic and the eyes have this kind of rapid eye movement pattern, and hence the rapid eye movement sleep or REM sleep. So we actually have sensors that can measure the eye movements, measure chin muscle tone, look at other things in terms of tone, respiration rate, oxygenation. So pretty extensive amount of sensors, but gives us a lot of data that we can really accurately tell when patients are awake, when they're asleep, what stage of sleep they're in. A lot of these newer devices are on the market, and they're getting better and better. They're still not quite the same as the lab. Many of them work by actigraphy, which is kind of motion sensor. So if you're moving around, it'll say you're awake. If you're kind of resting, it'll start recording that as sleep. May or may not be real sleep. If you lay there still for long enough, these devices will typically think you're asleep. But that's a little bit mitigated by manual entering in of when you're asleep. So, if you tell the device, I think I was asleep here, and it kind of looks at the data of the movement in relation to that, that's a lot of how they're tracking these sleep parameters. Now, they will sometimes measure sleep staging a little bit, and it's not 100% accurate, but they'll look at particularly like the Oura Ring and some of these other ones. They'll look at kind of some of the
sleep quality, like What are they measuring?
Yeah. So they're measuring a few things. So a lot of it, they'll try to stage it based on heart rate and oxygenation. And actually, sometimes they'll use something called peripheral arterial tonography, which is kind of the dilation of these little arteries in, the finger, or the wrist, or wherever the device is worn. And what this is measuring is essentially how much variation is going on. Where we know REM sleep, there's a lot of variation in pulse rate, in oxygenation, in dilation of these arteries. So they're kind of using that to measure and get a sense of you get a sense of when REM sleep is, or deep sleep, where we're having very slow breathing, lower oxygenation a little bit, everything's very stable. And again, they're not 100% correlated with the lab, but they're getting better and better and better, where I think, not in the near future, it's, pretty minor differences between the in-lab studies and some of these home devices. Not there quite yet. I have a ton of patients that come in and they're worried that their app told them they didn't get enough REM sleep, and it's not necessarily anything to worry about. But really interesting dynamic, and I think as we go forward, we incorporate more and more of these devices into not only sleep medicine, but also workouts and kind of routines to kind of track our sleep there.
No, I was just saying, I think it's super, I think for sure it's going to be more and more incorporated, but people have to understand the limitations. That's sort of where I was getting at, and what you brought up is there's just so many people that will get married to the results of their Aura Ring, and they're like, my sleep is terrible. And I'm like, but everything looks great and you're well rested. Who cares what the number says? Maybe it's not right. So I think they're a powerful tool, but we have to be cautious with the technology, just like, using our Instagram to learn a bunch of stuff and not out at night before we go to sleep.
Right. Yeah, there's actually a whole I think it's called orthosomnia, some circles, where it's this whole kind of insomnia that's generated from obsession about these devices and our data. So, there's people that are literally giving themselves insomnia and over the stress of not getting enough sleep from monitoring this data. So, it can absolutely backfire. I think it's something interesting, and I think there is clinical value in looking at these devices and the sleep characteristics, but yeah, certainly not the end all be all, in terms of measuring things.
Absolutely. I want to get into what causes us to sleep badly. I think we've mentioned a bunch of them. One I definitely want to talk about, and maybe we start there, is obstructive sleep apnea, or sleep apnea in general. I think it's one of the most underdiagnosed medical issues, and really a root cause problem of chronic medical issues, period. Yeah, exactly. I think that I've been able to identify so much more sleep apnea now that I'm aware of it. I've learned more about the role of vitamin D, the role of anatomy. And I think when I was trained, there's this idea that sleep apnea is obese people. Oh, here's an obese person. They have this anatomy where there's not a lot of room for the airway and they have fat here, and they're going to stop breathing. Or there's central sleep apnea where the brain tells you to stop sleeping. It comes from the brain, and that's a more serious medical problem. That was how it was presented to me. And now, as I'm learning more in my career, I'm like, no. This is a serious issue driving obesity, driving psychiatric issues, like you said, ADHD, depression, just mood lability, right? Just people with, so let's just do it. Let's jump into sleep apnea. Tell me your thoughts, because I think it's so important for people to understand what is sleep apnea and what they should be looking out for if they think they might have it or their partners might have it.
Yeah, so it's a very great, very important topic. As you mentioned, sleep apnea, it's very, very prevalent and very, very unrecognized. So most people right now we know who have sleep apnea don't have a diagnosis of sleep apnea and aren't even aware that they have sleep apnea. Essentially what happens in sleep apnea is anytime we sleep normally, our muscles relax. In the case of sleep apnea, these muscles of the airway, the tongue and some of these other little airway muscles are relaxing a little too much, where they're actually blocking off and not allowing us to move enough air while we're sleeping. There's a couple causes of this. I mean, you kind of hit the nail on the head where most people think it's you're obese. And that does happen. If you're obese and you have extra weight, the tissue just kind of pushes everything closer together, essentially. The tongue actually holds a lot of weight, believe it or not, so it just makes a crowded space. But many, many people who are not obese have sleep apnea as well. A lot of it's anatomy. So if you just have a kind of a narrow posterior airway compared to the size of your tongue, everything's just close together, that just a little bit of relaxation of those muscles and things could block up. A lot of it's how the dynamics of that airway are moving. Anyone, whether you have a narrow airway, large airway, can breathe. We won't be alive. We won't be able to survive. So we all have the ability to move air. So a lot of it's how much these muscles are relaxing with sleep that causes the issue. And we know that's changed by a few things. So we know that, again, weight plays a role. Age actually plays a role. With the older we get, these muscles get a little bit more floppy. Hormones actually play a role. So estrogen, believe it or not, is protective of the airway tone. So that's why women have a little bit lower degree of sleep apnea until after menopause. And then actually many women develop sleep apnea as well. It's kind of a little debated right now, but for a long time, we really thought that if anyone was undergoing testosterone replacement therapy, they really should be screened for sleep apnea because, just having that extra testosterone makes the airway a little bit more floppy and maybe a higher risk of sleep apnea. So can look all different shapes and sizes. Kids can get sleep apnea. Thin people, and I have some bodybuilders that are really in shape. They have obstructive sleep apnea, so it's really, really prevalent. Now, kind of the signs that you'll see with sleep apnea is one of the main signs is snoring, and snoring is just the vibration of that air moving across that narrow tissue. Not every patient who snores has sleep apnea, and not every patient who has sleep apnea snores, but there's a very common association there. Other signs could be waking up in the morning feeling unrefreshed, even though you got a good duration of sleep. Usually sleep apnea is a little bit worse in the deeper stages of sleep, like REM sleep. So as people try to drift into those stages, the airway collapses and they pull themselves back up to more light sleep. So you'll wake up even after an 8-hour, night period there, and you'll still feel tired because you never got the deep REM sleep and other stages of sleep. Other times it just looks like tiredness during the day. So people come in fatigued, they're wondering why. And, sleep apnea is a very underdiagnosed reason of why people are fatigued. Sometimes it looks like insomnia. So many times with this airway collapsing, people will wake themselves up to protect the airway. And so their main symptom is just waking up all through the night. And they'll think they have insomnia. And then we actually do some testing and some evaluations and find out that they actually have sleep apnea. And then we worry for sleep apnea for really two kind of categories of reasons. One, the sleep quality effects. So how, waking up at night is obviously unpleasant. Wake up in the morning tired, feeling tired during the day. But then also a lot of these other health risks, particularly cardiovascular risks. So we know that risk of high blood pressure, heart attacks, strokes, arrhythmias such as atrial fibrillation, these all go up. The chance of getting these all go up if you have untreated sleep apnea. And then, as you mentioned as well, so even things like mood, depression, anxiety, these are things that are worse with sleep apnea. Interestingly, like even diabetes, kind of as the stress hormone release, as we talked about earlier, it's been shown to be increased if you have sleep apnea. So if you're not breathing for a 30-year day there with sleep, what happens in sleep apnea can be very, very detrimental. So it's important, if you're having any of those symptoms, snoring, gasping, choking, pauses in breathing during sleep, waking up at night, or just feeling unrefreshed despite a good amount of sleep. Those are good reasons to get evaluated by a sleep doctor. Make sure, or any provider that's familiar with sleep medicine, and make sure that you don't have something like sleep apnea.
Yeah, and you can just go to your doctor. They have the formal sleep studies where you could go into a clinic. They strap you in and do a formal study. But I know that a lot of folks are doing sort of these take-home sleep studies where you put a pulse ox monitor that communicates with the computer. You take that home, you sleep in your normal environment, and that's a pretty good measure of sleep apnea, right?
Yeah, they're pretty good, the home testing. They don't have all the sensors that the in-lab has. They're not quite as accurate, but usually they give us a good ballpark of what's going on. There's a couple of medical indications that we would not recommend that, but majority of patients, can get away with a home sleep test. Pretty easy to do. It's not too cumbersome. You're in your home environment, which in some ways is maybe a little bit more of a natural representation of your sleep than a sleep lab or in a foreign environment. And yeah, so most of my patients, unless they have a reason not to, I often start with a home sleep apnea test, and usually it gives us the data we need. The one thing to keep in mind, and I've had a lot of patients come to me, having a home sleep test that was normal, is the home sleep tests in general tend to underestimate sleep apnea. So for that reason, they're great to rule sleep apnea in, but they're not so good to rule sleep apnea out. So if you have, patients come and they have symptoms of sleep apnea still, and the home sleep test said they didn't, or was negative or normal, we can't 100% say that they don't have sleep apnea on that test. So if you really feel like symptomatically, you have these signs and symptoms of sleep apnea, but you've had a home test that, your primary ordered or someone else ordered and they told you that was normal, it doesn't mean that you don't have sleep apnea. But in general, it's a great tool. And most of the time, the patients come in, they think they have sleep apnea. The exam looks like they have sleep apnea. We do the test. These home tests will show that they have at least, they at least have as much sleep apnea as we see in those home sleep tests. So, great tool that we use very often these days in clinical practice.
Yeah, I bring it up because I think most people don't want to have this. They envision this like sleep center. They're going to get strapped in, and I just keep emphasizing to people, no, this is a simple test. And yeah, if it's negative, we can't say for sure, but then you can go to the next level. But certainly, it's easy for anyone to get this kind of test. It's not scary, and man, it can change your life. I've seen so many patients' lives just dramatically changed, and healthy patients, people that are healthy but have these issues that doctors, you're fine. And then I'm like, well, this could be sleep apnea. And I actually work with a dentist here in Woodland Hills. I'm in the Valley. I think you're in the city here in Los Angeles. I work with a dentist who does sleep restoration with me, and I think it's so cool because he has this portal into the airway. Who else is seeing that many airways, that many uvulas, teeth? He helps me make assessments looking at grinding patterns and the changes in the uvula, and it's just been so great to work with him because he's opened my eyes to this whole world of really sleep apnea, because I just think it's so prevalent. So many people's primary issues with sleep is that. There's others, we'll get into it, but before we do, what can people do? I think there's some stuff I do. I'm curious what your approach is to sleep apnea, other than obviously a heavy person and we work on weight loss. But most people hear that. What else do you do for it, or what can you do for it?
The treatments vary a little bit about severity. Typically one of the main options we'll use historically and still is CPAP, which basically stands for continuous positive airway pressure. Essentially, it's a box really that you sit next to your bed, and it has a tube, and there's a mask that you wear while you sleep. The masks have gotten much sleeker and smaller and more comfortable than they were in the past. Machines are pretty quiet now, but really all this treatment is doing is it's taking in that room air, pressurizing it, and it blows it through a tube, through a mask to keep that airway good and open. And it works usually pretty well, pretty quickly in terms of getting rid of the apnea. It can be an adjustment to get used to. I'm now sleeping with this device next to you with the mask on. That sometimes takes some trouble and error and trial shooting a little bit to get it kind of optimized in terms of comfort. But it's still a great treatment. A lot of patients do well on it. There's also oral appliances we use. To mention the dentists, and dentists are now sending a lot of patients in, and it's kind of more mild sleep apnea, mild to moderate. Technically, they can use these oral appliances that hold that airway a little bit forward. In the past, we used to do surgeries and kind of hack out a bunch of tissue in the back of the airway. It's not really done as much now unless you have like huge tonsils or something really structurally or anatomically causing the blockage. It generally just hasn't been shown to work that well, and it has obviously consequences with it being a surgical procedure. There's also some newer techniques that are involving neurostimulation, so devices where they'll install something in the body or have you actually use something that stimulates these muscles of the airway to either keep them open while you sleep or to strengthen the muscles. So there's a lot of different treatments out there for sleep apnea. Hopefully help with symptoms and help sleep better, get more healthy. And kind of two symptoms I want to touch on today that aren't always known to be related to sleep apnea that we sometimes see is, particularly in men, is actually using the restroom at night and erectile dysfunction. These are two often symptoms of untreated sleep apnea. So, a lot of patients that once we get their apnea treated, the blood flows better, they can get, better erections and alleviate their erectile dysfunction. You'll have patients that actually during the night, if you're having these apneic events, there's a lot of interthoracic pressure changes, releases different hormones that make more urine. So many guys, as they get older, they think, I'm waking up all night because my prostate, right? And that does happen, and it's important to get checked out. But, many times it actually can be that you're making more urine due to, sleep apnea. And a ton of other reasons of why you can make more urine, diabetes, other things. And definitely, this isn't meant to be necessarily medical advice. And if you have any issues, seek your doctor. But, sleep apnea is much more related to many of these other symptoms than people realize.
That's the biggest message here is if you're struggling, if you're working hard in the gym, if you're going for your runs and your walks and you're eating right and you're still struggling, and and someone tells you this is just how it is, it's not. There's stuff like you have to go to the right provider, and you have to open your mind to something that you've never heard about, because probably that's what it is. It's something you're not aware of. Before I want to talk more about other causes, because there's so many things that affect your sleep negatively. How do you feel about vitamin D supplementation and B vitamin supplementation? I think it's very powerful. I think getting an optimal vitamin D level, I always recommend D3 with K2. That's a whole separate conversation, but I'm just curious, do you use those modalities?
I do sometimes. Now, I use them a little bit more for complaints of fatigue than sleepiness, and it's a really hard to differentiate those two. Sometimes fatigue versus sleepiness. So there's a good data that those things can help fatigue, particularly if they're low. There are people that with sleepiness that we add those on, and they do get a little burst of energy and can help a little bit. So there are things that, particularly if patients come in and have excessive sleepiness, I'll sometimes look at, if they have low vitamin D. Sleep apnea can cause, or sleep quality issues can cause excessive sleepiness, but there's also conditions like narcolepsy or idiopathic hypersomnia, where patients actually just have pathological excessive sleepiness for other reasons. So I'll usually do check vitamin D off then as part of the workup, supplement that if that's low. B12 as well can play a role. So, those things absolutely, have their clinical role there.
I love it, and I think it's very important that we spend a lot of time on sleep apnea. I think we're like-minded on the idea that people need to think about this, like especially men struggling as they get older. It needs to be in the forefront of your mind if you're trying to optimize your health. But there's a million other things that you can do to sleep better, and things that keep you from sleeping better. I have a whole list, as I'm sure you have in your mind, but tell me, what are the most common things you see, and kind of your best tips to avoid those things?
So, a lot of patients present with, insomnia, not sleeping well, things like that. And, insomnia is a condition, describing not sleeping well, and there's different criteria that meet insomnia. But, most of the time insomnia is caused by something or multiple things many times that's disrupting sleep. So really the trick is teasing apart all those things and addressing them individually. Some of it can be mental health, where if we have a lot of stress, a lot of anxiety, those sometimes insomnia is a nocturnal manifestation of those things. And sometimes in the treatment's more kind of looking at the anxiety. Sleep hygiene plays a big role. If you're drinking caffeine late, tobacco use.
What is sleep hygiene? Because I've never heard the word. So what is sleep hygiene in general terms?
Sleep hygiene. So it's a little bit like played out a term, I would say, but it's generally just good, healthy patterns that set you up to have good sleep. So, they're sometimes they're simple, but there are, a lot of people are not aware of the things that you're supposed to be doing to have good, set yourself to have good sleep. So kind of the general ones are, don't drink caffeine before bed, try not to smoke, being on the phone, things like that. Sleep hygiene is a little bit of a component of something called CBTI, or cognitive behavioral therapy for insomnia, which really is the main treatment for insomnia. But it's just one small part of it. So it's just kind of healthy habits of treating, to kind of set you up to have good sleep. Same bedtime every day, same wake time every day, really trying to keep that circadian rhythm not confused and aligned. Things like that. Exercise, exercise is actually very, very helpful for sleep overall. However, you need to give yourself about 3-4 hour buffer at least to kind of calm down, unwind. You really just went through this fight or flight sympathetic activation period with your workouts that you need time to kind of de-escalate. You wouldn't run away from a bear and then lay down and go to sleep, so you really need to give yourself a lot of time after you exercise to, kind of decompress and relax and get some sleep. So, all those kind of just healthy things that you hear, not watching TV in bed is a main one. And it's actually part of something we call kind of stimulus control, where it's really, you want to get things paired with the bed that are sleep related and break anything that's not kind of conditioning you to sleep. So any activities in bed, on your phone, watching something on TV, working in bed, these are all taking away from the conditioning in terms of helping you get good sleep. So taking those things out of the bedroom is, part of sleep hygiene, part of CBTI. So it's very important. Again, it's not the end all be all. There's a lot of people that have sleep issues. They come see me and they were, told by friends, family, doctors, even that, stop drinking caffeine or whatever. It's good advice. It's usually always good advice, but there's often, much more to it than that. Mental health plays a role. Pain can play a role. Acid reflux, other sleep disorders like restless leg syndrome can cause a lot of sleep disruption. Alcohol plays a major role, and I see a lot of guys and males and females, but they'll drink to help them. They think it helps them fall asleep, which maybe it does a little bit, but there's this massive rebound effect where then they're up in the middle of the night, not really able to go to sleep, not able to fall back asleep. Looks like insomnia, but it's actually kind of the alcohol just wearing off and having this kind of physiologic response there. So, a lot of things can go into it, but, hopefully that kind of touched on a few of the major ones there.
You absolutely did. I don't know, probably in your space, the concept of sleep hygiene is used up, but I just think it's so important for people to think about it as a concept of like, what are the behaviors you can do to control the quality of your sleep? Because there's a lot that you can. And just to add some of the ones I definitely want to mention, try not to eat right before sleep. A couple hours, 2-3 hours is the general rule, similar to exercise. Also napping, if you're napping late in the day, and then you're trying to go to sleep a few hours later, I mean, that just doesn't make sense, but it's something worth mentioning because people don't think about it. Yeah. So if you're required to nap multiple times a day, I think it's time to go get a sleep apnea assessment. Yeah. I think you that. And then another just point to mention is, you mentioned the phone. We've mentioned that a few times, like the blue light, the kind of light that is emitted into your face, it really mimics the sun. So you're telling your body, wake up. So, there's different strategies people use that do want to use their phone, or that like have night shifts where they use blue blockers. So there's different strategies to deal with that, but it's important to realize that the light that we're getting from our phones and our TVs, you're not supposed to be seeing in the last couple hours of the day. And I'll mention one more thing, and it kind of wraps up what you're talking about, is I think thinking about sleep hygiene in the form of a night routine, an evening routine. I think both an evening and a morning routine are essential, but really like that evening routine, having your wind down period. I have my tea and I have my supplements. Me and my wife do that every night. We turn the lights into a certain pattern. We create this environment that is going to tell our brains it's going to be bedtime, and we kind of start creating that. So I think if you're not doing that, you can't, do that. Like create a sleep routine,
100%. So routine is key in sleep. I agree with you, both nighttime and wake time. Some of that's conditioning, some of that's getting healthy de-escalation habits down to kind of just decompress from the day. Again, I like to think about it through most of human history. You were active during the day, and then at night, kind of the same time every night, it got dark. You kind of winded down a little bit, and then you went to sleep, and then you woke up the same time every day. So having those habits of same bedtime, same wake time, and then really, I think one of the most important parts of the day for sleep is that last hour before bed. So many people, they're on their phone or they're doing something stimulating, and then they'll try to lay down and close the eyes and turn the mind off. And it's not really how the body and mind works. So, having that hour to do something not only relaxing, but almost boring, try to get yourself bored that last hour can really, actually serve you pretty well to sleep. I sometimes watch this British baking show. I don't like baking at all. but it just kind of bores me, and those British accents just make me sleepy. And no offense to anyone who's from Britain, but puts me to sleep and gets me tired. So finding something that you can incorporate in your routine, the tea, the act of sitting there, kind of drinking that, it can really be huge to kind of de-escalate, decompress, and get you ready for bed. And a lot of this is priming, priming you for the next step, where our bodies are kind of analyzing our environment and often subconsciously figuring out what we should do next. So if we're really active and doing a lot, our bodies are not, not thinking we're ready for sleep yet.
Absolutely. And just to add to that, I think, having that morning routine where if you can, you go straight out into the sun in the first few minutes of the day and give yourself even 2-3 minutes, because it tells your body now it's daytime, now it's wake up time. And for some people that are groggy all day, that didn't do that, they didn't give themselves a moment in the sun. I think that's a really important additional tool.
100%. It really helps strengthen your circadian rhythm there, your internal clock. And I've had some mentors that have mentioned that sleep really starts the minute you wake up. Getting good sleep really starts right when you wake up. So getting sunlight, being active, being careful with things like naps, caffeine, alcohol, all this stuff really helps strive to help you get better sleep.
Man, I love it. We talked about, if you have a few more minutes, I have
a
couple.
I'm good for a minute. Whatever we got here, I'm happy to help out.
Okay, first one, these are like questions from the crowd that I've been gathering. So caffeine, we mentioned don't drink caffeine, but can you give us like specific guidelines, specific times? I just recently heard some, but yeah.
So caffeine, how it affects sleep is it acts on these adenosine receptors, which the longer we're awake, the more this hormone called adenosine, or neurotransmitter called adenosine, builds up, and then as we sleep, it goes away. And caffeine blocks that. So you could be tired and drink caffeine and it'll look, kind of feel like you got well rested. I'm not against caffeine overall, but it's just important to know that if you have caffeine on board, it's going to make you not feel sleepy at bedtime. And I think that the one thing, there's this general sense that you should stop drinking caffeine by like 2 or 3. I actually think it's earlier than that for many people. And anyone who's having sleep issues, I really encourage, avoid caffeine after lunch. At the latest, and probably even more so in the morning. Maybe a little bit in the morning is fine, and after that I really try to avoid caffeine if you're having sleep issues. It has a half-life of around 6 to 7 hours, meaning it takes about 6 or 7 hours for half of it to kind of go away too. So if you drink a giant Starbucks coffee, halfway through the day, a couple hours later, 7 hours later, it's only half that's gone, and maybe another half-life happens before you sleep. You still have a decent amount of caffeine on board. So it's something I think that's a little bit, everyone kind of knows that caffeine wakes us up, but I think it's a little underappreciated at times in terms of insomnia. A lot of individual variation on how it's processed. So, it depends on the person a little bit, but anyone who's having trouble falling asleep, I think it's worth at least kind of exploring the caffeine, its role there.
Yeah, and everyone knows someone who can drink a cup of coffee and go right to sleep. So
right.
There's different people metabolize the caffeine differently, and people's brains process the caffeine differently. I think that's probably a whole separate conversation that we can have one day. We can dive deeper, but people do process it differently. We're not here to talk about pharmaceuticals, but I think that as far as sleep aids go, melatonin is something that comes up a ton. And that was one of the questions. What's the role of melatonin in helping us sleep? When should you take it? Does it?
Yeah, so all great questions. So melatonin, it's actually produced by our bodies naturally, and that's actually how our circadian rhythms are in large regulated. When light actually suppresses melatonin being released from the pineal gland. So when the sun goes down, then it's released, and it drives this internal clock and circadian rhythm and makes us sleepy. So, kind of think about in context clinically, and, certainly you want to see a doctor before starting anything, whether it's, a supplement or a medication. The way it works, it actually doesn't work that great for kind of insomnia. So if you're just kind of, a little hyper vigilant and you try to take, melatonin, it might make you a little groggy, but it's not going to really kind of work the way it works naturally. So the studies have shown that the way it does work well is modulating your circadian rhythm. So if you have jet lag, or you're someone who's kind of a delayed phase sleep circadian pattern, you're trying to get to sleep early, that's where melatonin has more its role. You're trying to shift your clock a little bit. That's where we know melatonin works a little bit better. The data, it's not without risk. So again, make sure to see a doctor before you start taking melatonin. But a lot of the data shows it's not too bad, kind of short term. So I do a lot of patients that try it, and it's sometimes worth a try. One thing to keep in mind, it's a supplement, and so not a medication, and because of that, it's not regulated the same way by the FDA. So usually I recommend trying to get pharmacy grade melatonin, which a little bit of a misnomer. It's actually not, it's not pharmacy grade in the strict sense, but it should be a little bit higher, hopefully accuracy in terms of the preparation. So just be careful, and what supplements you're getting does kind of matter for some of these things, and it absolutely has its role clinically. So again, anything circadian treatments that I kind of work on, I usually implement melatonin in some sense.
I love it. What else? I mean, I think we've covered so much stuff. We did a solid hour. Thank you so much, Dr. Roland. I guess if people want to find you, learn more about you, reach out to you, how can they do that?
Yeah, so I have my Instagram. I think it should be through the coach there, but it's just Sleep Dr. Roland. I do apologize. I get a lot of just kind of questions about sleep, and I don't always answer them. One, just going through them all, but two, just kind of medically, it's usually not the best kind of medium to address those questions. But always happy to have people follow and reach out and kind of connect there. Also, if you're living in the LA area, I do work at downtown UCLA, so I'm always happy to evaluate any sleep conditions or have any discussions about sleep there. If you just kind of Google, either my name or sleep medicine in downtown area. So yeah, it's kind of the best ways, I think, to reach me. And it's been great to be here. Great questions, everyone. I appreciate everyone for tuning in. And, again, I think it's such an important concept that, the Men's Health app does a great job looking at men's health, but just really remembering that sleep is a very crucial part of really anyone's health there. And, all the other goals that we have really need sleep in order to be kind of optimized there.
Absolutely. Doctor, thank you so much. Everyone out there, thank you for listening. We'll be back with more Instagram Lives with the Coach app. And yeah, we'll see you soon.
All right, thanks, Gary.
Later.
Have a good night, everyone.